Okay, so today I'm speaking with Maheswari Senthil, who's the chair of the Advanced Cancer Therapies Committee of the SSO. Welcome.
Thank you, Dr. DiMatteo. Happy to be here.
And we're going to talk about all the things going on with ACT. So can you tell us about the upcoming meeting in February?
Oh, absolutely. I think this Advanced Cancer Therapies meeting that's going to happen in Scottsdale, Arizona in 2025, February of 2025, is going to be one of our banner years because we have received a record number of abstracts, high-quality science focused on both translational science and clinical trials work in advanced cancers. And we have a great program set up for the people that attendees.
And how has the meeting evolved over, let's say, the last 4 or 5 years?
Significantly evolved over the last few years. Specifically, the focus on translational science has increased. What I have seen in attending this meeting every single year is the emphasis on translational science during the recent years has increased. And the number of junior faculty who are doing translational science and bringing this knowledge to this meeting also has substantially increased. And more emphasis on clinical trials is also happening. As you can imagine, we now have the pump trial and the stopgap trial are all regional therapies for advanced cancers. That's all being discussed at this meeting.
And how is the committee, and maybe the meeting in particular, able to disseminate all the knowledge about regional therapies? Things are changing so much. There's trials being done all over the world. How do you get that beyond just the meeting itself?
In a couple of ways. One is there are specific ways that the program influences the dissemination of the knowledge, because in addition to the scientific abstract presentations, we have symposia and workshop in which we bring in the top speakers and the leaders in the field to discuss some of these regional therapies and the advances that has happened to allow for further dissemination of this work. In addition to that, many of our members are participating in a lot of these discussions that are arranged by SSO to disseminate this knowledge further beyond what just gets discussed at Advanced Cancer Therapies. So it's a nice virtuous cycle where the knowledge gets discussed in this meeting, but then there is further dissemination in local and other national forums as well.
A large part of the efforts of the SSO is for junior faculty and trainees. And how would you say your committee and the ACT meeting has impacted them?
In many ways, I think we are very much aligned with SSO's mission and what you have been trying to accomplish this past year as a president, really emphasizing on the scientific growth of our surgeons. The two main aspects to the impact that our junior faculty can have is one is the surgeon scientist. The second part is clinical trials. And how we are influencing this with our junior faculty is in this year's ACT meeting. We have Dr. Martha Ziegler, who is the NCI Director for Surgeon Scientist Program, is coming in to give a talk, as well as having an open forum and open discussion about the opportunities, resources, and even the barriers that needs to be discussed to promote our surgeon scientist group. The second is now recognizing, and obviously you have led the field with the trials that you have done, but certainly the clinical trials is another way that surgeons can make an influence, and junior faculty should get involved in this. And we have a dedicated clinical trials workshop to inform our junior faculty to get involved in clinical trials, but also create network opportunities and identify mentors who can facilitate their growth in their career, both as a surgeon scientist or as a clinical trialist or a combination thereof. We are also providing travel awards, right? So for residents and trainees, there are 10 or more travel awards that are supported by the ACPMP Foundation, because we want to make it easy for people to come to this meeting, learn, network, identify mentors, understand the knowledge, and disseminate the knowledge. So all of this collectively is all geared towards the junior faculty and trainees.
Well, it sounds like a great meeting, and I'm hoping to be there to witness it firsthand. So thanks very much for sharing some insights with us today.
Oh, I look forward to seeing you there, Dr. DiMatteo. It will be amazing. And thank you again for having me.